भाई मेरी तो बड़ी पुअर कन्विंसिंग पावर है। आई कांट कन्विंस पेशेंट्स, तो मैं तो ये काम अपने एसोसिएट को दे देता हूँ। कई बार असिस्टेंट भी कर लेता है काम। दे ओनली कन्विंस द पेशेंट्स, आई कांट सेल। आई एम वेरी वेरी पुअर एट सेलिंग। आई एम वेरी वेरी पुअर एट कन्विंसिंग पीपल एवर सिंस माई चाइल्डहुड। हैव यू ऑल्सो फेस दिस प्रॉब्लम? Did you find it difficult to convince patients? Hi, I'm Dr. Bhavdeep Ahuja. I'm a dentist with 23 plus years of experience, and along with dentistry, I'm training and coaching colleagues on the topics of practice management, medical legal ethics, and finance in dentistry. So, in this video of mine, I will shatter a few myths around selling. Most of us have this notion that selling is about persuasion, is about communication, it's about convincing the patients, it's about luring the patient into your treatment plan, what you have made for the patient. Absolutely wrong. Selling is not about a skill where a speaker will come and blow away the audience, or blow, in our case, blow away the patients with your eloquent speech skills, and of course wonderful articulation, where you can actually convince the patients about how you sell. Suddenly American accent also enters our tongue. It's not about that. Sales is a game of energy matching. It is actually, if I have to define selling in one line, it is uncovering the need of the patient. And how do you uncover the need of the patient? By asking good questions. If you ask good questions, if you identify what are their needs, what do they want, not what we want to sell them, surely you will identify to uncover the needs and of course satisfy those needs, and both of the things then act in mutual benefit. Both of you have a mutual benefit. We gain money out of it and satisfaction, and of course whatever passion and purpose, as I said in my one of last videos. And the patient also gets a solution from their existing problem. So the question is, how do you uncover the need? You uncover the need by asking questions where you get more clarity. It's not about, you can say, a presentation to the patient. You can say where you do a presentation via your before and after, via your PowerPoint, where you blow away the audience, blow away the patient. It's not like that. Or the patient asks you a problem, tells you a problem, and you try to go in a Shankar Mahadevan breathless mode. Hello, a tooth has three layers: enamel, dentine, and pulp. Every tooth will have these three layers, whether the back tooth or the front tooth. And when the decay is in enamel and dentine, we try to fill it with normal filling materials. When the decay reaches a pulp, we try to remove the decay and use it maybe by root canal, and maybe we can do extraction also. But it is always better to save it. Don't go into the Shankar Mahadevan breathless mode and try to vomit out what you know. So that is what you have to avoid. Conversation is about, or selling communication, sales conversation is about letting the patient speak more. The golden proportion has to be 70-30. 70 the patient speaks, 30 you speak. If the patient has chosen you from another 10-15 in your area, nobody can say that we are the only one practicing in their area right now in this current era. So if the patient has chosen you from the 10-15 other in your area, you are one of the best in the patient's eyes, or you are one of the prime options in their eyes. So don't go in a mode to flatter them, don't go in a mode to impress them. Just let them talk, and once they are done with it, then try to give out the solutions, because every patient will have different unique kind of questions, and the answers will also be unique. So whatever you have remembered by heart or by your presentation is not going to work. We call this sometimes a death by PowerPoint also in sales meetups. So don't give the patient a death by PowerPoint. You are the best in the patient's eyes that is there. So let the patient speak, uncover their needs via those communications. And then of course, don't try to impress that patient. Have a conversation. Stop making I'm not saying that you stop making presentations. Have it, but only use it when the patient asks you to ask it. Do you have any cases pertaining to my case which you have done before, any before and after? Then ask a prior permission and go about sharing the case. But before that, at least let the patient speak up first. Because sometimes when we go into our presentation, we are so engrossed, we are literally making love with our presentation, and we don't the patient is mercilessly, I would say, or mercifully looking at his or her watch, एंड कि कब ख़त्म करेगा इसका प्रेजेंटेशन, यार मैंने इसको पूछा कुछ नहीं, अपनी अपनी राम कहानी सुना रहा है, अपना रोना रो रहा है. वी हैव टू आइडेंटिफाई दैट द पेशेंट विल नॉट बी दैट पेशेंट समटाइम्स. सो the patient has to be uncovered in terms of needs, and that is how you identify. Some will choose you after your answer, some won't choose. So what? So sales is not about persuasion, not about convincing. It is about listening to the patient with two ears, identifying what the patient wants, and then giving back the options what the patient needs, not selling what we have. So I hope I'm able to put it across to you what I mean by selling hair. So if you find value in this video, please do share with your friends and colleagues, and please don't forget to subscribe to my channel. And I shall be back soon next Wednesday with one of another of my videos. Bye bye. Take care.